templates should include fields or requests for specific clinical information necessary for the consultant to review. The more information you put on a consult, the easier it is for that consultant to know what the priority is and schedule it. Inpatient and outpatient services are separate. So as an example, when someone is an inpatient, renal's consulted, they evaluate them, they follow them, and they make recommendations for the patient. Renal recommends follow-up in their clinic. An outpatient consult needs to be placed in order for the outpatient renal clinic to follow the patient. If the patient's been seen by the renal clinic within the last year for the same problem, a new consult is not needed. Just as a hint, if outpatient follow-up is desired sooner than later, inpatient consultation is recommended. Each specialty clinic has its own service agreement, so when you submit an outpatient consult, you must meet the requirements in that consult, or that clinic can discontinue it. An anticoag clinic is an exception to the rule. Every patient who is on anticoagulation therapy needs a consult at the time of discharge, regardless if they're established in that clinic or not. It's a way that they track their patients. All right. The next subject is how to order labs for outpatient follow-up. You're going to begin at your orders tab, and you're going to pick from the left-sided column, the lab menu. And then on the lab menu, you're going to have a whole list of different places, different VAs that you can select from. So for the labs that you want done at Ann Arbor, Toledo, or the Flint and Jackson C-Box, you're going to first pick the site that you want it done at. You're going to go to the column that says Return Visit Labs in the center column. Select the desired test, and you're going to pick the lab test by their name. If it isn't one that you can select, you'll go to the right column and pick the other lab test by name. Then you're going to pick the collection type, which for an outpatient is send the patient to the lab. And then for the collection date, you're going to put the date desired for this lab draw, whether it's 3 days or 3 weeks from now. Then you will accept the order and sign the order. You're going to, after that, highlight that order, select Action from the top of the toolbar, select Alert when results, select the name of the provider you want these results to go to, such as it's a renal follow-up and you want the renal provider to be notified, or their PCP, and then you're going to click OK, and then this lab result will pop up in that provider's alert box when it's resulted. Labs at the Battle Creek or Saginaw VA, you're going to again start off by picking the desired location. You're going to check the remote facility lab request. You're going to enter your name as the ordering provider, enter a diagnosis, check who to contact if there's a critical lab value, such as that primary care provider at their original VA, or you could put in one of our clinic contact numbers if that's what's needed. You're going to again select a date to perform the lab test, check the labs that you want drawn, and you're going to select the clinically indicated date, select outpatient, and sign the order. Labs at other facilities that aren't listed above, you're going to go to your consult tab, pick New Consult from the left center, pick the referral coordinator from the top left column, select Referral for Care. Most likely you will select this consult is not related to a service-related disability. You're going to type in the PCP if not listed already. You're going to type in the primary care team if it is not listed, and then again you're going to type in the labs desired, the date desired, and how often at that location of the VA is desired. For example, a basic and a mag drawn in 1 week at Bay Pines, Florida VA, and then you'll say OK and you'll sign that order.